Thank you all for joining today's Speakers Bureau orientation. Today's webinar is a collaborative effort between Hep B United, our CDC partners, and the IW Group, an advertising and public relations agency that has been working in partnership with CDC on the No Hepatitis B campaign. During our time today, we will provide an overview of the Speakers Bureau and discuss resources, including the Speakers Bureau Toolkit and the CDC No Hepatitis B campaign. We'll also have a session on Asian media and share media tips and training, and we'll close with a Q&A session. So joining us today as your presenters are Kate Morales, Senior Program Director at the Hepatitis B Foundation and Director of Hep B United, Sherry Chen, ORISE Fellow from the Education and Training Division of Viral Hepatitis at the Centers for Disease Control and Prevention, and Hiroko Hatanaka, Vice President of the IW Group. So before we get started, I want to review a few housekeeping items to let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and will be muted during the presentations. After the presentations are completed, we'll be holding a Q&A session, and there will be two ways that you can participate. First, at the start of the Q&A session, you will have the option of being unmuted to ask your question to any of the presenters. Alternatively, feel free to submit questions in writing during the presentations by typing them in the chat box in the lower left-hand corner of your screen. And please do indicate to whom the question is directed. We'll be reviewing them as they come in and address them at the end of the session. So today's webinar is being recorded, and you'll receive an email with a link to view today's presentation after the webinar. So before we get started, we wanted to give everyone a chance to introduce themselves. So in order for this to happen smoothly, we hope, we put together a slide with everyone's name. And so we ask that you just kind of go down the slide and briefly state your name and the coalition that you're affiliated with. And this is just to get a sense of who we have as speakers, Hep B United spokespeople, and a chance for you to get to know one another and where you all are from. And so you will be hearing that your line is unmuted when you are ready to talk. So can we start with the first person on the list? We have Andrew. I don't know if you're on the call yet. Okay. Let's see. All right, next we have, I'm sorry if I butcher this, Buntan. Okay. So, okay, I'm just going to go down the attendee list then, and let's see. Helen Lamb. Okay. All right. So we are having some technical difficulties, so we're going to go ahead and move past the introductions. This is our first time trying it through this format, so this will be a lesson learned for the future. Thank you for bearing with us. So with that, I'd like to go ahead and hand it over to Kate Morales for an overview of Hep B United.
Thanks, Michelle. Can you hear me?
Yes.
Great. Good afternoon, everyone, or good morning. We wanted to give you a little bit of a background about Hep B United. For those that are unfamiliar or not in official partnership with Hep B United, and also as background info for when you are engaging with the media, to takeaway is to let folks know that there is a community-driven national effort to address hepatitis B in the Asian American, Native Hawaiian, and Pacific Islander communities. Just to give you a little bit of a quick history, Hep B United was formed in about 2012 informally with the support of the Department of Health and Human Services. We are now about 20 plus coalitions. So we're a coalition of coalitions that focus on the AAPI communities. Our local coalitions are comprised of any combination of community-based organizations, med students, healthcare providers, state and local health agencies, as well as community health centers or health clinics. Our main goals are to support and leverage the success of our local coalitions nationally to increase hepatitis B awareness, screening, vaccination, and linkage to care. And again, our overarching goals and our mission is really to raise the profile at the national level and improve access to care and treatment for those living with hepatitis B to prevent liver cancer. I won't go through all of the activities, but a snapshot of some of what we've been doing over the past couple of years. We have built off the momentum of a landmark report that was released in 2010 by the Institute of Medicine and the HHS agency report, our national plan to combat viral hepatitis. We organized our own community plan from the national plan to coordinate our work across the country. Our community action plan has now been updated for 2014 to 2016. It includes activities that cover 4 main goals of that plan, including addressing perinatal transmission, community and provider education, screening and testing, as well as surveillance of hepatitis B data. And so as you can see, these are some of our activities. I won't go through all of them. I do want to note that we are continuing to develop a capacity building program, or working on a capacity building program that includes training seminars for the public at large as well as our Hep B United partners. We officially partner with the Centers for Disease and Control No Hepatitis B campaign, which you will hear more about later in the program. And again, those are 4 focus areas of our current community action plan, and some of the materials from the campaign, which you will hear about later. Our website is www.hepbunited.org. We're also on various social media channels, including Facebook, Instagram, and Twitter, and YouTube. I would leave you with, again, as being a spokesperson for Hep B United, just letting folks know when you talk to them that there is a national effort, there is an entity that is working together to address hepatitis B across the country. And Michelle will go into more detail, but there is a fact sheet available about Hep B United and a listing of our members for you after this presentation. Thanks, Michelle.
Thank you, Kate. Now I'd like to go ahead and take a few minutes to talk about the Hep B United Speakers Bureau and give a brief overview of the toolkit that was sent out to all the spokespeople yesterday. So Hep B United developed an in-language Speakers Bureau in an effort to elevate awareness and address Hep B in Asian and Pacific Islander communities across the country. So over the past several months, Hep B United members have submitted recommendations for in-language spokespeople within their local community. The intention behind the Speakers Bureau is to disseminate accurate information about hepatitis B to our AAPI communities through newspaper, television, and radio interviews with local ethnic media outlets. These interviews promote Hep B awareness, screening, vaccination, and linkage to care for all, but particularly for our high-risk Asian and Pacific Islander populations. And it's also a great opportunity to be able to promote your local coalition's hepatitis B events and efforts. So connecting with media can happen in a few ways. And one way is for an opportunity to arise where a speaker will be needed in a certain Asian media market. For example, to help promote the No Hepatitis B campaign in Houston, the IW group linked Chen from Houston's Hope Clinic to a Chinese radio station. And Shane was able to do an interview on a Chinese radio talk show host and not only promote the No Hepatitis B campaign, but also promote the Hep B prevention services offered through Hope Clinic. And another way to connect with media and the media and spokespeople is through the Hep B United website. So on the homepage of our website, you'll see that you can now find a tab for the Speakers Bureau on the upper right-hand screen. So once you access the Speakers Bureau webpage, you'll see a list of speakers and the languages they speak. From here, you can select a speaker to access the speaker's bio page. Dr. Sue Wong has graciously allowed us to showcase her for today's webinar. So thank you, Dr. Wong. And you'll see here on Dr. Wong's page the coalition she's affiliated with, along with a brief bio. So if someone wants to set up an interview of some kind with Dr. Wong, they'll be able to do so by clicking on the Contact Us button on the lower left-hand corner of the screen. Then Hep B United will receive the message and facilitate the connection. So in that way, no one will be able to contact the spokespeople directly, and Hep B United will field those kinds of outreach. So you won't be able to get any, they won't be able to contact you directly as a spokesperson. The Spokes Bureau webpage and bio pages are currently in progress. So after the orientation today, we'll follow up with you about your speaker bio page. So next, I'd like to briefly go over the Speakers Bureau Toolkit. Inside the toolkit, you'll find a one-pager about Hep B United, including the list of our local partners. You'll also find a hepatitis B and liver cancer fact sheet, as well as a summary of current Hep B policy initiatives. And updated information on these policy initiatives will be posted on the Hep B United website policy page. You'll also find in the toolkit a CDC fact sheet on the No Hepatitis B campaign, which Sherry Chen will be going over in more detail shortly. And to help prepare spokespeople, also contains ready-made talking points about hepatitis B and AAPIs and the No Hepatitis B campaign, as well as talking points for Hep B testing and treatment. The toolkit also contains a list of helpful Hep B resources and links to in-language educational materials, including some from our local partners. And here on the slide, you'll see that we have a brochure from Charles B. Wang and a postcard from our partners at Hep Free Hawaii, and as well as APTO's B Activated Toolkit. And now I'd like to pass it on to Sherry Chen, who will be providing us with more information on the No Hepatitis B campaign. Sherry?
Hello, thanks, Michelle. So as Michelle mentioned, I'm with CDC and I'm going to be talking about the No Hepatitis B campaign. And as Kate and Michelle have been saying, just to kind of give some context for what you guys are doing and how you guys can help us support what you guys are doing in the context of this national campaign. So the goal of the campaign is to increase testing for hepatitis B, and we've partnered closely with Hep B United. And our audience are Asian Americans and Pacific Islanders, in particular those who are foreign-born with limited English proficiency. And we have resources and materials in 3 primary languages: Chinese, Korean, and Vietnamese, with information in English as well. And then some resources in additional languages, so Burmese, Khmer, Lao, and Hmong. So the campaign was launched in 2013, as Kate mentioned, and picture from our launch event. So for our communication objectives, we do want to increase testing for hepatitis B, but we also want to make people more aware of key facts. So a lot of these are in your media toolkit, but the fact that 1 in 12 or nearly 1 in 10 AAPIs are infected, most people who have hepatitis B don't know it. There are often no symptoms, and a blood test is needed to figure out if somebody has hepatitis B. We also want to make the link from hepatitis B to liver cancer, and doing so hopefully decrease stigma associated with hepatitis B. So this is just an overview of our campaign materials, and you've seen glimpses of it in the past talks, but we have video PSAs and radio PSAs, print resources like posters, ads, fact sheets, risk assessments, templates that you can localize with your own information. We also have banner ads, infographics, buttons and badges, e-cards, and then some provider clinical tools. They've also included our website, so all of these materials are available on the website for you to download and use however you might need. So for implementation for the campaign, we partnered closely with Hep B United. So the CDC develops and tests the materials, but we really need input from community groups and Hep B United members and all of you to give us feedback on the cultural relevance and how it's working in the communities that you serve. And we also distribute the campaign materials nationally and conduct media outreach in key Asian markets. And then with Hep B United, we really rely on you guys to extend the reach of the campaign into local communities and provide education, direct services and testing, and leverage community leaders so that they can be involved in the cause as well. So for our national strategy, we've reached out to TV stations and in promoting our PSA. So the PSA is in Chinese, Korean, Vietnamese, and English. We've gotten donated time and stations throughout the U.S., as well as had a limited digital ad buy that links people to our PSA, which is on CDC's YouTube. This past year, in 2013, when we did this, we got an airplay of almost 1,600 spots and a media value generated of $357,000. And then this year we're doing the same thing with our new PSA. So I think we're going to show you guys the new PSA if you haven't seen it already. Great, thanks. Hopefully you guys heard that with audio, because we didn't, but hopefully that worked for you guys. So for the radio strategies, we've also promoted our radio PSAs in Mandarin, Cantonese, Korean, and Vietnamese. And in select markets over a 6-week time period, we've gotten it played in 1630 spots with over 27 million impressions. And then we've done the same with print, a paid distribution over 6 weeks with 6 to 8 insertions per week and over 4 million impressions. So this is just a map of the media placements. These dots are where we have Hep B United coalitions in these cities. The blue dots are where we've been able to get the media placements. And so as you can tell, it's not in every city, but that's where we really need you guys to get to come in. So with doing these media outreach for partners, so IW Group works with local media to promote local experts and testing services, and that's where we would like to just bridge that gap from our national campaign to asking you guys to reach out to local media and talking about hepatitis B and promoting your local events, and really linking people to where they can get tested and linked to care. And we hope that we can help with providing some educational resources. So our resources. So we have fact sheets for consumers that are in one page with English translations on the back. You can use the content for interviews and share these at stations. These are like simple information, basic information about hepatitis B. We also have these risk assessments. Again, they're bilingual in multiple languages. It's a quick way to assess somebody's need for hepatitis B testing based on where they're born, and just kind of it's an easy way to like assess if somebody should be tested. And we also have a 5-minute online version that encompasses hepatitis A, B, and C, and covers if they should be tested or vaccinated. We also have posters, again, in Chinese, Korean, Vietnamese, and English. You can order these from the CDC warehouse or download them from our website. What some people have done is add their local testing events and local logos to the posters and then submitted them as ads to local media to promote their events. The next slide has some examples of that. So then there are also flyers for screening events where you can do the same, add local community information and send them to the media or use them as flyers to promote events. And again, we have radio and TV PSAs. So I've heard that some stations will play these before your interviews, but you can also submit them to stations that might, like more local stations that might not have, might not be playing these PSAs. And then finally, we have some digital content with just some quick facts about hepatitis B. These are only in English, but there are a lot of key information that we want people to know about hepatitis B. So you can take a look at these and just kind of use them if they're helpful. And then finally, we have some provider tools. These are more information heavy and are only in English, but they provide a little bit more technical information about hepatitis B if you or your volunteers want more information. So that's it. If you have any questions or want more information, you can email me or Cynthia Jorgensen, who couldn't make it today, but is my boss. Thank you.
Thank you, Sherry. Again, you're welcome to type in any questions that you may have in the chat box on the lower left-hand side of your screen. And so now I'd like to go ahead and turn it over to Hiroko Hatanaka, who will provide us with some information and tips on working with Asian media and preparing for interviews. Hiroko?
Thank you, Michelle. And hello, everyone. My name is Hiroko Hatanaka. I work for IW Group. For those of you who do not know about our firm, we are the communication company specializes in reaching out to Asian American in the United States. So we work company like McDonald's, Walmart, and CDC, of course. So today, I would like to take you through a little bit about the Asian media, where are we going, and the characteristics and how to work with the media, and interview principles and techniques, and I would like to end up with some samples of that. So in language media is growing very fast as the number of Asian population grows. That so is incredible growth of Asian media. But I just want to point out that the major increase is actually coming from Asian Indian media entries, because they have a lot of media coming in, right? So next page. In language media is very important for those people who just arrived in the U.S., or those people who do not speak English or read English well. When you look at each population, 82% of Korean people really watch or read or listen to Korean media, and 81% for Chinese, and 80%. And as we see that, they tend to getting away from Asian media. The next please. Okay. So for hepatitis B outreach, we are focusing on Chinese, Korean, and Vietnamese. So let me just look at those, the characteristics of these media. The growth is really, they are all growing, but the growth is coming from digital. Digital is becoming such a great force in Asian media. However, though, I have to also point out to you that the print media still plays a key role in these groups. When I look at the Asian media market, we can identify about 4 top Asian media markets. Number 1 is LA. Los Angeles offers a variety of Asian, particularly Chinese, Korean, and Vietnamese media. And then number 2 is New York. New York has about 12% of Asian population, and New York also offers strong Chinese and Korean and Indian media, but very little Vietnamese or other Asian population. Number 4 is Houston. There, we see a lot of increase in Chinese and Vietnamese as well. And if you go to Dallas, which is not in here, I would say that Korean media is growing there very fast. In order for you to understand exactly how Asian media works, maybe I would like to start with Asian media characteristic, or really broad characteristics. Okay, most Asian media is basically national media that composed of news from homeland and some from communities. When you look at the, say, World Journal, for instance, I don't know if you have done it or not, but if you look at it, it's a huge paper. It has a multiple section. But the key is that you pay attention to the community section, because that's where the domestic reporter writes into this section. And the other section comes basically from homeland, from Taiwan or Hong Kong or whatever. So also you should know that the Chinese media has 2 characteristics of languages. One is Cantonese and one is Mandarin. As you know, that I think Cantonese is the first immigrant population to this country. So Cantonese still continue to have a very big role in Chinese language broadcast scene. But Mandarin is gaining power quickly. The last thing that I also want you to know is that Chinese print are offered in 2 ways of writing. One is traditional Chinese and simplified Chinese. And many people know that simplified Chinese is used in China, mainland China. So let me just give you an example how it might work. This is Chinese print media, just a few of them listed here, and how it is positioned to each target market. World Journal uses traditional, and most of the readers are from Taiwan. Qingdao uses traditional language, traditional characters, and it is very popular among people from Hong Kong. And the third one is Chaopao, which is called China Press. It is a mainland-based or mainland-supported Chinese print, and this is offered in simplified Chinese. There are more medias in LA, like for instance, Zhongguo Daily is traditional. The other one, Taiwan Daily, is also traditional. I don't know why they did not differentiate, but that's what it is. But the most important thing is that you have to pay attention to traditional and simplified Chinese paper offered here in the United States. Okay, so now let me go into each medium. Let me just look at the print media characteristics. This is a very well, established media, and it has a high recognition and then also high credibility. Quite often, health matter, which requires credibility, very useful for this. Print media is very useful. However, you have to pay attention to the fact that this media is often preferred by older segment. Okay, next. Okay, so let me just look at the more detail about the Chinese print. Well, example of World Journal is here. The World Journal is the most popular Chinese newspaper in this country, and they produce about 11 editions in the United States. Many articles are written by the parent company, which is in Taiwan, called the Chinese Daily News. And usually Section A is domestic headline news and the international news. The Section B is local news. This is the section that you have to pay attention to. And Section C is another national news, and then Section D, financial, and then to follow that with the entertainment and the sports, etc. Okay, so regional editions are carried by regional basis. Like for instance, if you are living in LA, you will have LA edition, like that. However, you also have to pay attention to the fact that the regional editions are available online as well. So if you look at the top of the World Journal website, there is a region listed on top. So you can click that, the edition, and then you can see what's happening in that market. Okay. World Journal has a health section. However, quite often that the detailed information is written by home office, so it's very difficult to get into that arena. We have to devise something for you to do something if you're interested in that. The radio characteristics is this is a very interesting media because it creates one-to-one connection, and drive time is a very popular time for people to listen to radio, in language radio. And also it is very important entertainment for at-home seniors as well. And radio is a good medium to maximize your reach because there are a lot of radio stations and they can reach out a lot of distance. The coverage is wide. Most Asian broadcast media stations are had a wide territory coverage, but also the unique things about Asian media is quite often they have DJ or talk show host who can be a very good friend to you and powerful in the community as well. So TV media, it has a broad reach, UHF, cable, satellite, IPTV, digital, and mobile, name it. And also the attract a lot of viewers. But for the dramatic increases is because Mandarin Chinese TV stations are coming to this country, like for instance CCTV, and they are airing the Mandarin news all the time. okay? And then this vehicle is most effective for awareness building as well. So now let's, now that I have went through the most, well-covered media, so let's look at how to work with the media. I think the first thing you have to do is to introduce yourself and build close relationship with Asian media. Asian media, and also you have to remember that Asian media are a business organization. It's a non-profit organization. So in-language press release and materials are very critical and important because many reporters are not the specialist on one subject. I have not seen yet that reporter who write only health subject. So you really have to give them a accurate information, and that's why in-language press release and materials are critical to achieve that. And many Asian media have also limited stuff. Well, a paper like World Journal is quite well to do, but if you look at other medias, they operate with a very few number of people. And what you can do is that to make sure that you have to make reporters' work as easy as possible. Next. All right. So now I would like to move into principles and techniques for each media. I think you should understand what each media is looking for. For TV, characteristic is short questions to read the provocative answers. That's what they're looking for. So their goal is basically they want to have a attention-grabbing items on the screen. For print, it's a little bit, you can go a little bit in depth, and the reporters tend to collect a lot of information about that subject and write about it. The radio, controversial questions that allows elaboration and very focused on the audience. So therefore, can be very personal. And as I mentioned, the DJ and talk show hostess are quite critical in this area. This is their goal is they're looking for concise information because TV and radio, they have this time limit in their hand. I also hope that you should know about your audience. Your audience are the members of the Asian in-language community. The most of them do not know what Hepatitis B United does and what it means. Hep B is not the Chinese. Hep B is English. They may be afraid. And another thing is that those Asian audience, they may be afraid about Hepatitis B or have misinformation about Hepatitis B. So you have to think about what would you say to recent immigrant about importance of getting tested for Hepatitis B. Also, please avoid jargon and abbreviations. Hep B is not the known expression for Chinese, Korean, and Vietnamese. In addition to that, timing is also very important. Many Asians do not want to hear anything about Hepatitis B, cancer, or certain disease during auspicious time of the year, like Lunar New Year or something like that. So when you talk about hepatitis, when you want to talk about this subject, maybe you should use some other expression like good health for New Year or something like that. Okay? All right. So I just hope that you will be preparing before you go into interview. So before interview, make sure you familiarize yourself with the toolkit you have received or will be receiving from Hepatitis B United people. It will provide you your talking point, information about Hepatitis B United, and importantly, CDC No Hepatitis B campaign, and the link that they can go to, and the other helpful materials should have on your hand. And after the interviews, please do not forget, and I often forget too, ask media for the link or the files of the interview so that they can share that, what you have done, with your Hepatitis B United members. Okay, so continuing on that, I think many Asian media outlets, reporters look for who you are, who are the speaker. So make sure you have qualification ready, and make sure that person who shares the cultural language with the respective community, and of course authority on the subject, and also be passionate about your organization and what you do. Sorry, did I say something wrong? Anyway, you also have to be pitching your media. You know, nobody will come to you to invite a speaking opportunity. So you have to go aggressively after media. Asian media, TV and radio have many, many talk shows, and particularly like health and call-in shows, and many subjects that you can really segue into that. Okay? So another thing that you should know is that media company often have a couple of media outlets. So make sure if you get into one, pitch other media as well. Finally, just go ahead. Okay, thank you. And also the other speaker, I hope that you would not stop pitching to media only. You should really go out additional speaking opportunity, such as various Asian Chamber of Commerce meetings or churches or Asian Employee Network organization. The pitch is my suggestion to you. In conclusion, I just wanted to show you the recent example. Chen joined the interview with the Chinese Texas radio the other day. To be exact, it's on September 22nd. So if you like to hear what she has said, and this at the bottom of the slide, there is a link to it. And thank you so much for listening to me, and I'll be happy to answer any question you might have.
Thank you so much, Hiroko. And so now we would like to actually call on Dr. Su Wang, who has had some experience with Asian media and interviews around her work on hepatitis B. And we'd like to call on her to see if she can just talk a little bit about her experience and share it with us. Dr. Wang? Dr. Wang, are you able to get on the mic? I see you here on the attendees list. Okay, so while we're waiting, why don't we go ahead and open up the line for discussions. Again, as mentioned, if you would like to be unmuted to ask your question, please enter your name in the chat box and ask to be unmuted. We're going to try it again and hope that it works this time. Alternatively, you can also type in your question into the chat box and have it answered that way. And please remember to indicate who the question is that you are asking.
Yes. We're hungry, it's fine. Okay, so
We have a question for Sherry Chen from CDC. Sherry, will there be for the No Hepatitis B campaign, are there additional languages that the materials will be put out for?
Hello, this is Sue. Can you guys hear me?
Hi, Sue.
Oh, yeah.
Oh, great. Sorry, yeah, I had called in, but I guess I didn't enter the right access code, so I was permanently muted. So I don't know if I just interrupted something, or do you want me to share now?
Well, you can go ahead and share, and then we'll hop onto the Q&A session afterwards.
Okay, great. So, I mean, thanks to Hep B United, I had some opportunities to talk to some ethnic media at our last meeting. And then since then, we actually have had a number of opportunities locally with Chinese media, and then also with mainstream media. I think all of what Hiroko said is really important. I think that when you come to the meeting, definitely have some kind of ready quotes. They're always looking for something quotable, something brief. And so I always have on hand like some, ready facts that are easy for people to absorb and also are kind of have a big impact. So for like Hep B, sometimes people don't have a good idea of like Hep B and its world impact. So I will always often tell people that it's, we say 350 million people a lot, but they don't really know, how that compares to other diseases. So I always say that's 10 times the number of people in the world with HIV, and they know like HIV is a big problem, so that makes Hep B seem like, a much bigger problem. And obviously link it to liver cancer, so we talk about it being the leading cause of liver cancer, and then, all the other stats you guys probably already have in your mind, like it's 1 in 10 and 8, kind of short facts that people can put quickly into their articles. And then I think personal stories are really important. So I found that whenever I introduce the story of a patient, obviously completely anonymous, but just say, I had a patient who was 70 years old who came in totally asymptomatic but found to have a liver tumor, or somebody who had been seeing another doctor for 20 years and never screened for Hep B and found to have cirrhosis. And not all of you are providers, but I'm sure you've all heard some story of how Hep B impacted a family or somebody you know. And I think the newspapers really like hearing those stories because they can, it makes it a lot more tangible. So, and then I think timeliness is good. The reporters always want to like be on something that's new or some new update. And I think the fact that we have this USPSTF recommendation is really important, and so it makes them feel like they're onto something, newsworthy when we say, USPSTF just came out with these guidelines, and so they're really important because this is an update from before, and previously it wasn't recommended, but now it is recommended, and it should change, insurance coverage and everything. So these are all timely reasons. Even if you're trying to pitch a story, they kind of feel like Hep B is not that important. To say something like this kind of makes it more urgent. And then so Kate had asked me, said, how do you deal with if somebody asks you a question and you don't answer it? So I think you can actually learn a lot from the politicians because they do this very well. So, they just completely ignore the question sometimes and just answer whatever question they want to answer. Or you can say something like, I'm not sure about that, but, and then, bring up, make sure that you get your important points across. Or you can always say, that's an interesting question, but what we do know about hepatitis B is, X, Y, Z. Or you can just say, I can find out for you and I'll get back to you. And I think it is important to get their information, to get their cards, and then give them your cards so that if there's further clarification on the story, you can give them. What I've often done is when I get back to my office, I'll send them more literature or an article or something else to kind of fill out fill out the interview with additional information. So, and a lot of these are some of them we've developed good relationships with, so that if we have events coming up, we'll invite them to it, or we'll write a press release for like a little blurb of some event that we have, and they may not come to our events, but they'll cover them. And we've also found that it helps because we work with both, as Hiroko mentioned, that some of the newspapers are Mandarin speaking and some are simplified and some are traditional. So we find that it's actually important to cover both because different audiences read different newspapers. So in order for you not to seem like all mainland or like all Taiwan, if you can reach out to both kinds of newspapers, it's, I feel like that's important. So that's what I have. Is there any questions?
Thank you, Sue. That was really very informative. So we're going to go ahead and do a question and answer portion at this time. So again, we tried this in the beginning with unmuting everyone to try to have a discussion. If you would like to be unmuted to ask your question, please chat or type that into the chat box on the lower left-hand corner of your screen, or alternatively, you can type your question itself into the chat box. And before Sue shared her experiences, we had a question for Sherry Chen at CDC with regards to any plans for additional materials for the No Hep B campaign in additional languages.
Yeah, so that's a really good question. And realize there's a need for so many more languages. We're keeping that in mind as we plan for the next phase of our campaign, which we're doing right now. So I think the best thing to do is just to email me and let me know what the request is. It's really helpful to hear what you guys need. So yeah, so if there's a specific request for a specific language, let us know, and that's helpful for us when we do our planning. I hope this helps.
Thank you, Sherry. We have another question, and it asks, are spokespeople expected to do media outreach? That's a good question. In the past, what we talked about earlier was that there are a couple of ways that spokespeople can connect to media, or media can connect to spokespeople. And, we're fortunate that we have IW Group who has been helping with those connections. Spokespeople are not expected to outreach to media themselves. However, you are more than welcome to. There are often times when spokespeople are needed for certain events. And, an example of that is we did have a Hep B United launch along with CDC for the No Hepatitis B campaign, and we did have a need for outreaching to you for help with those events. Any other questions? Oh, okay, I see another question here. So if you are not in an area, and this is, I guess, for Hiroko, or anyone who might have some experience with that, if you are not in a major Asian media market, can you tell us what the difference is between working with Asian media and mainstream media? Or maybe Dr. Wong can answer this as well.
Yeah, I think it was interesting. A lot of the ethnic media have allowed us to kind of put together our own articles for them. Whereas when I worked with Star Ledger and they came and interviewed, they actually wouldn't let us review the article beforehand, and they were just a little bit more strict about how they did the whole process. But I think they were still really good and let us know exactly when they were going to publish it. They did quite a good job with the story. So it just depends. I think it was also we had so sometimes actually if and the reason we were able to finally get mainstream media is somebody in the hospital. We have a PR person in the hospital, and they had some connections. So it does help if you kind of know some people who already have some media connections. And it may even be they actually sent out a reporter who was a summer intern. So he was very meticulous. And I think for a lot of these reporters, you'll get a lot of back and forth where they want to get more specific. They want to get more questions. And initially we had told them a story of a patient, and the marketing folks were a little bit nervous about them releasing a patient story just because of HIPAA issues. But they said, well, you already talked about it. It's on record. So it's interesting. They actually said, well, we can't necessarily take it back because you already, discussed this with us. So you do have to be careful and make sure that you, talk about only what you're willing to have printed. And in the end, they did kind of work with us, and they said, okay, we'll take away his age, so it's not as specific. It's kind of a more generic patient story. So, yeah, it was interesting. There were some differences that I noticed, too.
Dr. Su Wang, I think you're right. You have described everything that I was going to say. Just to add one thing is that, and in a way, that Asian media is much easier to work with because they take your comment most of the time face value.
Mhm. Yes, that's true. I remember now. Actually, the Star Ledger reporter wanted documentation of everything that I said, like the USPS. He would actually come back to me and say, where did you get this about, like, insurance coverage is covering the USPSTF guidelines? And so I had to dig it out for him before, they would put it in an article.
Thank you. Really good points to know. This is also for Dr. Wang. The question is, did liver cancer resonate more with the reporters?
Yes, I think it depends a lot on the reporter's background and their own information on Hep B. So some of it you can also ask them, what do you know about Hep B? Do you have any questions about it? And so I think in general for the lay public, the liver cancer is a lot more tangible. And when I was at Hep B United and I spoke with World Journal, we ended up, it was for the World Hepatitis Day, we had a film screening of a great documentary on Hep B, and so there was a reporter there, and the issue of stigma came up. So that was actually, I think there are certain issues that I feel like it's up to us and really important for us to bring out there as advocates and to kind of try to get rid of all those, we know there's so many myths that continue to be propagated about Hep B that, really as a community we should try to bear this as a burden as a community, not so much put blame on other people, and that we as a community need to be more open about it. Otherwise, there are a lot of people who never get screened because their family members, don't want to talk about it. So I feel like some of the issues that we know are issues in the community are issues that we should bring up when we talk to the media.
Great, thank you. And you mentioned, Dr. Wang, you mentioned earlier that, adding personal stories on Hep B kind of really helps people to, get more, it makes it a little bit more relevant to them. So, Dr. Wang and Hiroko, can you give some tips about how to incorporate personal stories on Hep B in your interviews?
Well, this is Hiroko, but it's a very, very challenging, actually, question to me. The personal story is always very effective, but depending on who we're talking about, if it is your experience, that probably resonates very well with the Asian media, but if somebody is talking, my friend had this and that, maybe not so much. I think it's depending on who is your media and what kind of question that they're asking, what you wanted to prove, everything. So I can't really say this is the way you should present your personal story to me. Maybe Dr. Wang has different point of view.
Yeah, I think you do have to gauge the reporter and just be prepared. I think it definitely does help just, before you speak to somebody, just for 5 minutes, collect your thoughts and kind of prepare, kind of and I think all of us really know so much more about Hep B than we even realize. Like, there's so many things that you've just learned from, doing the work for so long and stories that you've heard, and sometimes you kind of forget. So if you just kind of stop and think about, what you've heard, then when you actually talk to somebody, it's just kind of at the ready, at your fingertips. So, I think, all of us at some point have heard some advocate talk about, some family member that died at age 40, they had young kids, and, what a shame, this should not be happening. So I think always having at least one story ready is good because it really brings it to life.
Thank you. And we have another question about where should spokespeople send media clips or recordings of interviews? And so on the last slide here, you'll see an email, which is connect@hepbunited.org. You're welcome to send it to that email address, or also to Kate. She is the director of Hep B United, which I believe you can reach her through that email as well. Do we have any other questions?
I have a basic question. Sorry, I'm just because I know I'm unmuted. How do you put, and this is kind of dumb, maybe somebody can walk me through it later. How do you put like into a PowerPoint presentation? Do you have to have web access, or is there some way you can save it as a file and play it, like if you don't have internet access?
So you can download the YouTube video, like the actual video clip from our website. This is Sherry, by the way, from the CDC website. Under the section for the TV PSAs, there should be a link for you to download that. So if you don't have internet access, you can hopefully get that. But if you do have internet access, you can just embed the video in your PowerPoint and take people there.
Okay, great. That'll be great for talks that we give.
Oh, yeah, it'd be awesome.
All right. So if there are no more questions, we will go ahead and wrap up. Thank you, everybody, for joining us, and thank you to our presenters. If we were unable to answer your question today, or if you come up with a question later on, you can always follow up with us at connect@hepbunited.org. You can also learn more about Hep B United and our members on the website, www.hepbunited.org, or follow us on Facebook, Twitter, or YouTube. And please look out for an email from Hep B United, which will include materials from today's webinar. Thank you all again, and have a great rest of your day.